Children's medications are in short supply, and you can blame the triple-demic on that.
That's right. With cases of COVID, flu, and RSV on the rise, what can parents do to help their kids feel better? We have Dr. Alana Kennedy-Nasser from PurePediatrics joining us now. We were just talking during the commercial break. You're seeing a lot of COVID right now, and the symptoms are a little different.
Yeah, we're starting to see an uptick in COVID again, and what we've seen is some kids getting fever, and so hence, we're having a lot of flu and RSV and other things causing fever, and we're having medicine shortages, as you know, but we're seeing more COVID that's starting to uptick again, and my guess is because we just had the holiday season and everyone got together and was trapped at an airport together and with family, we're going to see another little spike coming up soon.
So let's talk about what families can do if they go and they're trying to find something to comfort their child and they can't find those medications. You might want to turn to an adult medication and say, hey, I've got this, I'll cut it in half or whatever. How do you go about doing that, and what is the safest way to make sure your child is okay doing that?
Yeah, I think that we've seen a medicine shortage for Tylenol and Motrin, the generics called acetaminophen and ibuprofen. I've first been surprised at how many parents don't realize that those are the generic names. And so when you go to your pharmacy, look through the entire aisle, look for the generics first of all, look for chewables. Liquid, I kind of say leave that for the little infants. So if your kid can take a chewable, do a chewable. If they can swallow a pill and they're over, say, 6 or 7, swallowing pills, they're very small. It's very easy. And so if we can teach them, just remember your food that you swallow every day is bigger than a pill that you're going to swallow. And so, we can always train them to swallow pills. When it comes to adult medicine, go to your pharmacist, ask. So the dose is what's the most important, not whether it's a liquid or a chewable or etc. So you really just want to ask your pharmacist or ask your doctor to make sure you're actually giving the right dose and you're doing it safely.
Okay, what if you dig in the back of your medicine cabinet and you see some medication, you look at the date, it's expired. Can you ever use expired medication? Is there a window there?
Yeah, that's a hard one. I think the true party line is if it's expired, you want to discard it.
That's what I do. Yeah, I'm always too worried.
It's probably the safest thing to do, especially liquids, etc. And so it might not be as effective. I mean, the good news is I don't know if it would be harmful per se. It's a day expired, for example, but it might be less effective. And the other thing I've urged parents to do is ask your neighbor. This is a great time to go to your neighbor and say, hey, do you have any Tylenol on hand, or any Motrin?
What can we do besides medications if they have a fever? Try to keep their body cool, even though they're probably going to want to be warm.
Right, that's true. I think it's really important to remember that fever is just a symptom of a disease. It's not a disease itself. So if you have a little kiddo and they're running around at 102 and they're perfectly fine and they're eating and watching TV and on their iPad or whatever it is they're doing, they don't have to necessarily be treated because they feel fine. So treat the child, don't treat the number. I think parents worry a really high number means they're more sick, and that's not true either. And so the number has nothing to do with how sick the child is either. So treat the child. You can do a little kind of cool bath, like lukewarm. Don't make it cold, don't make it hot. Little cool compresses and rest fluids.
And lots of TLC. Right. Love them as much as you can. Try to get them through it. All right, Dr. Alana, so helpful. Thank you for being here.
Thanks for having me.
It's good to see you.
You too.